As we begin a new week, there's one question on everybody's minds right now. Will restrictions ease when the heightened alert period ends on Sunday, June the 13th? Well, sounding quite positive, Health Minister Yong says that things are heading in the right direction. In a handwritten note he shared on social media yesterday that covers the last 3 weeks, Mr. Ong pointed to 3 key indicators: the number of those quarantined before detection, not quarantined but linked to clusters, and unlinked cases. According to Mr. Ong, the percentage of infected people who were detected while under quarantine has gone up from 57 to 73%, which means there's less chance for them to spread the virus to others. Now, more encouraging, he said, is that the unlinked cases have fallen from 18 to 15%. And as you can see, the number of total cases have also been dropping. Separately, in an update on the mass testing exercise in Yong last night, more than 3,700 people who lived or visited HDB blocks in the vicinity have tested negative for COVID-19. With some results still pending, just one person has so far tested positive during the swab tests. For a closer look, I'm joined by Professor Dale Fisher, infectious diseases expert from the Yong School of Medicine at NUS. Now, Professor also chairs the National Infection Prevention and Control Committee. Welcome back, Professor. COVID-19 figures in the past few days seem to indicate that we are heading in the right direction. Now, today's number is also in its single digit of 5. Now, we've also seen mass testing exercises being carried out to catch possible hidden cases. So based on all this, Prof, how are things looking for Singapore as we head towards June 13th?
Thanks for having me back, Haryanto. Yes, we can see things are obviously on a good path. I'm not convinced that we're going to see major changes on June 13th, just because what we're doing is actually working. You see, the problem is we've got this very infectious strain, this Delta strain or B1617. And not only is that more transmissible, but we're seeing it circulate in a setting where 30 or 40% of Singapore is vaccinated. And we know that vaccination causes more disease to be asymptomatic. So this is a good thing, of course, but obviously when you're trying to track the virus, you're going to get more asymptomatic people, or as you describe, more hidden cases. So this is why we need to, if you like, dig out the circulating virus by doing these mass testing campaigns. But you know, the numbers speak for themselves, and with all the testing that's being done and all the efforts being done by people that live in the country, they're all we're seeing everything come together quite nicely. But June 13, do I expect the ministry to undo a lot of things? There may be some tweaks, but they're certainly always looking to balance the health threats against the economic and social impact of the interventions. So maybe in that respect, there might be some tweaks because things are going well, but there's serious light at the end of the tunnel now with the pandemic, being over potentially. So I don't think they want to spoil things as we're sort of moving into that phase.
Right, Professor, I just want to touch on the mass testing exercises that we were talking about earlier on as well. Thousands were tested over the past weekend, especially in the context of the Yong situation. What do you make of this mass testing exercises, moving forward in Singapore's strategy to maintain or to manage the pandemic? Is it worrying that, we're heading towards that direction? Concerning even?
Well, all these sort of non-pharmaceutical interventions, the NPIs we call them, they're really the backbone of our efforts. But they don't seem to be enough just to do symptomatic people and contacts, because as anyone that's been following the numbers over the last few weeks will see that there's just so frequently cases that at least at the start aren't linked. So if you've got unlinked cases, then you need to and you really do want to keep control, which we do at this stage, then obviously this mass testing is important. So I think it's a good, thorough strategy, because this pandemic isn't over. It will be over, but it's not yet, and we have to just keep going with this sort of, aggressive tactics, if you like, until we get up to that very high vaccination rate that we're after.
So, aggressive, ramped up efforts in testing. Now, we are in a different situation compared with the post-circuit breaker last year. On top of ramped up efforts in testing, we are better equipped to trace, and not to forget as well, people are getting vaccinated. So what sort of reopening are we likely to see, Professor? A gradual one or a more targeted approach?
So this phase is new territory, obviously. We haven't come out of the pandemic. We're seeing some countries talk about it, Israel and UK, with vaccination rates around 60%. So there does get to a point where cases don't matter so much. We used to know that cases meant more cases, and it would exponentially grow. Hospitals would get overwhelmed. Excess deaths would be realized. But eventually, when we're vaccinated well enough, a case won't mean that. A case will mean a cold, where you may not even get tested and you might just stay home to recover. That's where we're going to end up. But this phase of where we are now through to that point, which will probably take most of the rest of this year, I think we still need to navigate. We still need to work out how we can loosen the screws without leaving behind the people that still aren't vaccinated.